disability team. Very pleased to welcome you all. We're going to have talks from some members of our team, Stephen and Brigitte, and from a guest speaker, Tim Hart, who's our guest from South Africa. Just a couple of housekeeping things. We do have 2 sign language interpreters, Louise and Sandra, who will take turns to sign the talk. So if you need sign language interpretation, please double click on Sandra and then Louise is pictures, and you will get an enlarged version of their image. You can also click on captioning. If you go to the 3 dots menu, you'll find a place that says switch on transcription, I think it says. If you have any difficulties while we're during the show, then please write something in the chat box and we'll endeavour to help out as much as we can. So this is a sort of combined lecture seminar about 3 pieces of work that we've done about COVID-19 and its impact on people with disabilities in 6 countries. We've called it 3 studies, same story, for reasons that will become more obvious later. So there'll be 3 talks, short talks about the 3 studies, a couple of videos, and then some Q&A at the end. So we're going to describe these 3 studies. So the first one is called Lives Turned Upside Down, and it's in 5 countries, and Stephen will talk about that one. That was a qualitative piece of work using narrative interviews. Then we're going to talk about a large online survey that we collaborated with in South Africa. And then, in contrast, a very small piece of work in Nepal, working with teenagers with disabilities in rural areas using innovative methodologies to find out what they thought about COVID. And then there'll be some reflections and some drawing together and some question and answer time. Okay, so just quickly a bit of background. So as soon as the COVID situation emerged, the disability community and agencies involved in disability started to predict that there would be a need for a particular attention to this topic. So UN bodies, INGOs, organisations of people with disabilities and others all predicted that there was going to be a particular difficulty for people with disabilities if an inclusive approach wasn't used. A large number of documents came out predicting this and also advising about how an inclusive approach could work. So there's a big body of knowledge about that. They all, although they all had a slightly different focus, they all were warned that there was a likely exacerbation of the disadvantage that people with disabilities have anyway. They advised that inclusive approaches were going to be really important, and they said that a disability inclusive approach to disaster risk reduction and pandemic preparedness was needed. So many countries have policies that have at least some mention of disability, but most countries in the world don't implement most of what they suggest within their policies. Okay, so there are some other studies about disability and COVID. There are more than these. This is just a few of them. So there are a couple of big global surveys looking at asking people themselves about their experiences, but also surveys asking about OPDs, organisations of people with disabilities, responses, how they've responded to their members' needs. Also, a study looking at INGO responses. There are country-specific pieces of work. There is more in the global north than in the south, as you might expect, and some of them look at particular aspects, so about access to healthcare or rights or vaccines or these kind of things. So there have been quite a lot of studies. So ours just fits into that big jigsaw puzzle of what's been looked at so far. So over to Stephen from IDS to talk about the first of the studies. So Stephen, just tell me when you want to move on to the next slide.
Great, thank you, Mary, and nice to be here. So as Mary mentioned, I'm going to speak through this piece of work we did, which was under the Inclusive Futures banner, which is UK aid funded research. So there's Inclusion Works and Disability Inclusive Development, which are 2 big disability focused programs. And as the world was changing, as the COVID pandemic hit, we pivoted some of our ongoing work to focus more specifically at looking at the experiences and perceptions of people with disabilities and how they were experiencing the COVID-19 pandemic. Okay, Mary, next slide, please. So this piece of work involved narrative interviews, which are largely a storytelling based methodology. And we conducted them online, and we did 2 interviews per participant because we wanted to see how things might be changing over time. So the interviews were undertaken roughly 2 months apart. And the reason that we selected this methodology was, firstly, we wanted to be as inclusive and as accessible as possible, but also we felt it was really important to give the participants the chance to say what was important to them. So really emphasising, that instead of imposing research questions on them, that they were given the opportunity to speak freely about their experiences of the pandemic. But importantly as well, narrative interviews provide insights into contextual aspects. So doing this study across 5 different countries, it was quite important that those insights were provided, and they can also provide an insight into people's emotions and their feelings during those times. So the focus was Nigeria, Uganda, Kenya, Bangladesh, and Nepal. And the narrative interview approach is largely regarded as being accessible regardless of education, language competence, or communication mode. So we felt that the method was a very good fit for what we wanted to do and the type of information we wanted to find out. Next slide, please, Mary. So in terms of participants, there were 75 participants involved. 30 of these were from Bangladesh and 15 from Nepal, and then 10 each from Kenya, Nigeria and Uganda. And the reason that there was more from Bangladesh and Nepal is because we had ongoing work there with the 2 programs, so both Inclusion Works and Disability Inclusive Development. And so we had slightly more time and networks to gather participants from those countries. The gender balance, we managed to get more or less 50-50. And in terms of impairments, we aimed for to gather a range of people with different impairments, and we felt it was really important to try and make sure that there was at least some representation from the different or people with different impairments. And so we very much wanted to make sure that people with intellectual impairments, people with psychosocial impairments, and people with more complex or multiple impairments were included, where quite often in research involving disability, people from these groups can be excluded. Okay, next slide, please, Mary. So setting up the research was also, we thought quite hard about how we might do this, and again we wanted to be as inclusive as possible. So we were already working with 4 local researchers in Nigeria, Kenya, Uganda and Bangladesh, one of whom has a disability, but we also recruited 3 new researchers from Nepal and Bangladesh, 2 of whom had disabilities. And several of these were early career researchers. And so we wanted to not only get them involved, but we saw this as an opportunity to try and develop their capacity. And also we very much recognised that the learning opportunities were mutual, and I think we as a team also learnt a lot from those researchers from different contexts. So that was a really nice aspect to this project. So we undertook an oh, sorry, Mary, could you just go back for a second? Thank you. So we undertook training to make sure, and in some cases the training was a refresher for those who had more experience, but for those who were newer to some of these research techniques and approaches, it was very much something new for them. So I think we did a good job in building their capacity. So the process was roughly training the researchers, undertaking the interviewers, undertaking a participatory analysis, so involving the local researchers and the IDS team, and then importantly some participant validation meetings. And for me that was a very rewarding part of the research process, and it was really it was fascinating not only to put the findings back to the participants and check that we had understood correctly, but also the participants were very interested to learn the experiences of people from different countries. So that was quite a nice part of this research process. Next slide, please, Mary. So this quote, I won't read it out, but this was from one of the early career researchers who had a disability from Bangladesh. So this was the first time she'd been involved in any significant way in a piece of work like this. And I think she found it a very positive experience. And so as well as doing a very, very good job at gathering the data that was needed, I think her capacities also developed as a researcher. So that was quite a nice part of the process. Okay, Mary, thank you. So we've got two short videos now from two of our researchers, Shadrach in Nigeria and Anita in Nepal. So Mary, can I ask you to start the videos if technology allows?
Oh, sorry. This is Anita.
Namaste. I am Anita, a partially sighted girl from Nepal. Before sharing my experience of research, I would like to thank IDEA's team for providing me this opportunity to work as a researcher in research impact of COVID-19 to people with disabilities in Nepal. The research was quite new and exciting for me. It had to be conducted online and through mobile phones, adapting narrative operas, and to people with complex disabilities like deaf, blind, autism, and intellectual, psychosocial, and multiple disabilities. While doing interviews, what I personally felt is that listening to the pain, sufferings, hardships of people from different social media and hearing from their own voice is quite different. The situation was too emotional and painful to hear. I personally felt like I was going through the same situation. I made the diversity of people with disabilities and their experiences of COVID 19 was different, like their diversity. Oh, on the other hand, the interviewee's curiousness about if I have disability or not, if I have what kind of disability I have. This also became a medium to create closeness between me and interviewees, through which they were more open and share their experiences without hesitation. Uh, in some cases, interviewees were irritated to talk for a long time as it was in a virtual mode, and it is really hard to people with autism and intellectual disability to stay in one place for a long time and talk. So to sum up, coordinating with the OPDS and HI for selecting participants, scheduling Zoom, orienting interviewees for using Zoom, holding one-to-one interviews, transcribing the interviewees really helped me to accomplish the tasks independently and confidently. I really love the storytelling approach of the research. Continuous guidance and supervisory role from IDEA's team added strength in me. Uh, Last but not the least, what I want to share is that if provided opportunity, disability law does not limit the possibility. Inclusion and meaningful participation matter the most. Thank you for this platform to share my journey as a researcher. Thank you. Namaste.
And from Shadrach from Nigeria.
Traditional methods of qualitative data gathering are mostly extractive. The researcher would already have an idea of what optional responses the subjects or respondents would return. On the other hand, I have found the narrative or storytelling approach to encourage the spontaneous emergence of data. We used this during our study of the impact of COVID-19 on persons with disabilities in Kenya, Uganda, Bangladesh, and my country, Nigeria. People are more comfortable to tell their own story how they know best. The narrative approach allows them to take their time, no restraints. They can even express emotions. In that process, they feel empathy. The mere fact that someone cares is part of the solution for many. On my part as the researcher, the entire story constitutes a rich collection of knowledge from which I can resolve the what, why, how, where, and when questions in one go. Otherwise, I may need to follow up with prompts. Storytelling allows and encourages participants to be reflective, and so produces close to accurate representations of the situation being studied. Ironically, one challenge with this method arises from its strength, and that is the fact that respondents are mostly in control. There is always a chance that stories and examples would veer away from the focus. But managing this without seeming to take away the respondent's liberty greatly depends on the researcher's social engagement skills. In all, I personally find storytelling a more colorful approach than, say, semi-structured interviews.
Okay. Let me just go back to the slides.
So just while the slides are coming back up there, watching the videos made me realise I perhaps haven't emphasised enough the importance of the partners. So both the NGO partners and the organisations of people with disability partners as well, who very much facilitated and assisted with putting this research together.
Sorry, it's just waiting for it to share. Oh, where's it gone? Okay.
Okay, so thank you. So in terms of the main findings, there was the concrete and material impacts, so the impacts on people's earnings and so on, which could be expected, but then also their subjective and the emotional impacts. So that was the two ways that we tried to make sense of the data we'd found. Next slide, please, Mary. And the emotional side of things, you know, in many ways was quite shocking. There was a lot of uncertainty and fear, loss of opportunities, loss of freedoms, and of course, really importantly, those limited social relations in terms of lockdowns and government responses to COVID-19. So people with disabilities, like many other people, lost education and work opportunities, and this had a really big impact on people's hopes and future prospects. Being stuck indoors during lockdowns had a big impact on people's health, not just physically but also mentally. Next slide, please, Mary. So I've included a few quotes here. I won't read them just in interest of time, but people found it very, very hard being stuck inside for long periods of time. And you know, the impact of that was quite significant, and that uncertainty came across very strongly across the 5 countries that we looked into. Next slide, please, Mary. So the economic impact, and there was a lot of feelings associated with that economic impact. So people with disabilities are experiencing major negative economic impacts, and this had an impact on their livelihoods, on whether they were able to provide for their families, which caused insecurity and immense stress, and leading to many feelings, but including anxiety, despair, and depression. Next slide, please, Mary. So, as with many people, the people we spoke to, their economic situation was significantly impacted by COVID-19. But in many cases, because people with disabilities were already at a disadvantage, COVID was found, or COVID and the national response was found to exacerbate this experience of marginalisation. Next slide, please, Mary. So another feature that we found from the data was that stigma and discrimination was exacerbated. So negative attitudes, and in some cases fear of people with disabilities, was made worse by the pandemic. And this seemed to impact on people with certain impairments more than others. So people with visual or physical impairments who perhaps needed support, for them the situation seemed to be even worse, and people with deaf blindness were particularly badly affected. And we also noted a gender impact when looking at the data. So gender-based violence was something that came up again and again, although in many cases the participants themselves hadn't always experienced that, but it was certainly something that was on their minds and something that they could speak about from their communities and within their social circles. And there was also quite an interesting piece around cultural norms and expectations for different people within society. So in most of the countries we focused on, males were seen as the breadwinners, and the inability to provide for families was putting extra stress on them. But then for many women, there was other pressures based around disrupted domestic situations at home. So the gendered impact was something that came across quite strongly in the research. Next slide, please, Mary. So as I mentioned, we did 2 rounds of interviews to look at changes over time, and of course the 5 countries experienced the pandemic in slightly different ways. So, you know, whether they were at different stages of government responses, or whether they're in different waves of the actual virus. And our findings in this sense were mixed, because there was a sense of positivity coming with the second round of interviews. So people had gone back to work, people were getting on with life, trying to return to some kind of normality. But then there was also some people who continued to be worried and had anxiety about whether there'd be another wave, or that they had borrowed money to see them through the first wave. And so then they had exacerbated financial concerns. So it was a bit of a mixed picture over time, but perhaps that was to be expected, given that each country was in a different position, and of course each individual household and each individual person would also be in a different context with different pressures and stresses. Next slide, please, Mary. So just to conclude, we found that people with disabilities were often marginalised already and financially insecure before COVID, but that the crisis had really made this situation worse. And the pandemic had resulted in feelings of uncertainty for pretty much everyone we spoke to in these 5 countries. Okay, Mary, I think that's it.
Okay, thanks very much, Stephen.
Thank you.
So that was great. If people want to hold any questions they have to the end, we're going to do recommendations and conclusions for the 3 studies at the end of the 3 presentations. Okay, so over to our colleague Tim Hart, who we're very glad to say is a colleague from South Africa, but actually is physically in the UK at the moment. So it's really nice to welcome him here. And over to you, Tim, to talk about this project that we did jointly with you and your organisations.
Thanks very much, Mary, and everybody else. It's nice to be here in somewhat sunny Sussex. So let me get straight into it. This study was it was a partnership of IDS, the Human Sciences Research Council, and one of our local disability service organisations, the National Council of Persons with Organ for Persons with Disabilities. We looked specifically at socioeconomic well-being and human rights related experiences throughout the pandemic. Pandemic's lockdown features started in South Africa approximately the 27th of March 2020. And what we did was we developed an online survey based on inputs from IDS colleagues, the HSRC colleagues, and also persons with disabilities at the NCPD. And we really wanted to see what was what were the experiences of people with disabilities in a single country, and that was South Africa. Mary, next slide, please. So just as a bit of a background, in South Africa, there's quite a lot of contradiction and uncertainty about the actual number of people with disabilities in the country, and it ranges over the past almost 10 years. It's been ranging between official figures as low as 7%, estimates of around 12%, and then some other studies showing that there are about 20% of people who have some type of impairment that is disabling. We don't look at children under 5 years, so the data refers to everybody over 5 years of age and over. What we wanted to have a look at with the study, one of the motivations was to see what was the impact of COVID-19 on persons with disabilities? Was it making life better? Was it making life worse? Or what was the actual impact on South Africans and also just people living in South Africa with disabilities? Initially, before we started the research, it was quite a long process. But anyway, initially what we were getting were reports that people were being overlooked in terms of different disaster relief measures, such as food parcels, grants, other things. They were being ignored by the number of, or many of the pandemic directives, which really aimed at controlling the pandemic rather than mitigating the effects of the pandemic on the population. Neither the two acts that sort of govern the activities during the sorry, not the two acts, but the Disaster Management Act of 2002 and the Disaster Management Framework of 2005 basically governed the activities that government introduced in South Africa over the past 2 years. And neither of these two, well, the one act and the other one is a policy framework, neither of them actually acknowledge people with disabilities, and they definitely don't acknowledge the diversity between and within groups of people with disabilities in contrast to other vulnerable groups. So we have a whole range of vulnerable groups, of which people with disabilities is but one, and they're very diverse in between, within that group. And that goes unacknowledged in terms of the directives that were promulgated, in terms of the activities and so on. There is within the white paper, they have an implementation matrix in which they've tried to implement the white paper that came out in 2016. And section 3.5 of that implementation matrix looks at a disaster implementation framework that is supposed to make the management of disasters more disability inclusive. And we did tend to tackle that because we felt that it was not inclusive. I won't go into too much detail about that, but the end result was really that this particular part of the white paper matrix was grossly overlooked during the during the pandemic, and still is, with very little work being done since 2016 until the pandemic kicked in March 2020. So a little bit more background was that the study was online largely because of the strict lockdown measures introduced in South Africa. It had some challenges, despite the fact that there were virtually 3 different teams: a local team, an international team, and a local group of people with disabilities giving input into conceptualizing the study and designing the survey and what have you. Besides that, we still had some challenges. It was online, it was self-administered. We had no ways of following up as to see whether people actually understood the questions clearly, whether they'd actually responded to the questions. Sometimes people might not have proceeded with the study because they couldn't actually understand it. So we had no way of sort of intervening. It was also guided by, our selection of an online study was guided by the fact that we had these very strict lockdown regulations, and even the ethics committees had more or less prohibited fieldwork beyond surveys for a large portion of the time. So when we applied for the funding in that, we were really confined to a national survey. Anyway, so we designed as a team. We designed and gave designed a survey and a study and gave all our inputs and whatnot. And I think it was a very collaborative approach. A lot of knowledge was exchanged. Knowledge exchange was encouraged throughout from the beginning. I think there was a lot of respect between the partners, although we were very diverse in terms of, I think, our knowledge about disability from certain perspectives. We had different roles in not very, I wouldn't say hard and fast roles, but these were more or less different roles that the partners played. There was obviously some overlap, but IDS was the main partner, and of course they liaised with the funder, and they took overall leadership of the project. The Human Sciences Research Council team in South Africa really did the local project management and facilitated a lot of the partnership interactions at the national level. The National Council, often for persons with disabilities, were instrumental in getting us access to people with disabilities, and also other organizations within the disability sector. So we basically did in a sense, almost a snowball sampling. So we used the National Council and their affiliates to reach people, and then we also used people within the larger disability network within South Africa. And that was also coordinated largely by NCPD, but some of us had our own contacts within various networks, so we used those too. At the end of the day, we got about 1,857 people who responded, valid responses. There were some that weren't, we didn't use because people didn't give consent. I mean, that seemed to be the main reason, was about 34 individuals not wanting to give consent, either because of their age or just not wanting to participate in the study. So the high-level findings, we found that there were very little government interventions. Maybe I must just backtrack quickly. The study was rolled out between the 1st of July and the end of August last year, 2021. So that's about 14 or 15 months after lockdown had been imposed in South Africa. So we were asking people to reflect quite far back over quite a long period of sort of 15 to 16 months on their experiences. So there could have been some inaccuracies or limitations to recall during that. But what we found is that, and I mean, this is validated by other studies that took place in South Africa during the past 2 years. And we found that very little government interventions, quite a fairly heavy reliance on the disability sector, and also other NGOs such as those providing food relief. The communication about coronavirus and these monthly family meetings that the South African President Ramaphosa had virtually once a month on a Sunday evening on television, broadcast live, was a challenge to people. A lot of people said that they got a lot of their information from that because all the new regulations would be summarized very quickly in the half an hour or 45 minutes that the president spoke. But people were finding it difficult there. They couldn't see the South African sign language interpreters. Others could, well, there was no captioning, so those who were totally deaf and also who didn't have South African Sign Language as a language were unable to follow what was going on. This seemed to, as you know, people reported that this sort of resulted in confusion about the intervention services available during the pandemic. And it seemed that also people who generally got the services were those already on some sort of list with the Department of Social Development. So people who were already receiving either an old age grant or a disabled person's grant, they would get some updates, but those who were completely off or outside of the system really struggled to get updates on the type of services that they could receive during the pandemic. And I suppose this applies not only to people with disabilities, but also to people without disabilities. People with disabilities in our survey reported a lot of negative economic impact. So 30% were unemployed at the start of lockdown, and 13% of those lost their jobs. 11% of that 30% had to work at reduced pay. 6% were compelled to take compulsory leave. And it also had an impact on own businesses, because for the first 2 months, if you were not classified as an essential service provider, your business was virtually closed. And a lot of, well, not a lot, but a fair amount of South African disability service providers are actually disabled people themselves, so they were not prioritized. So, for example, somebody who would be in the business of repairing wheelchairs, crutches, etc., would not have been able to help and they would have had to stop running their business because of the lockdown. 31% of the respondents were receiving a disability grant, but of the total, so of the 1857, 33% were actually receiving this social relief of distress grant, which is very small. I mean, it's extremely small amount of money. It's 350 Rand a month. It's really a paltry sum. Most of the people who responded, I think over 60%, probably closer to 70%, were actually poor, considered poor or very poor, perhaps even extremely poor, living on less than sort of 500 Rand a month, which equates, I'm not sure if I get it right, but about £25. But so 60% here were getting less than 238 Great British pounds per month, but the majority were getting far less than that. Okay, so yeah, it's it was quite. They are economically hard done by a sector of society, and it was worse during the pandemic. We also asked, as part of our study, what were unusual experiences, so experiences that you perhaps would not have experienced pre-pandemic times. So South Africa has quite a high level of unemployment in normal times, if I can call it that. High levels of food insecurity during normal times. So we wanted to find out about unusual events that people experienced. And so here we see that food security, insecurity rather, was for people who hadn't experienced it before. It had now climbed to 40% of people suddenly experiencing food insecurity, either themselves or somebody else in their household, for a period of anything from 1 or 2 nights up to sort of one or 2 nights a month, irregularly. But I think the most shocking thing was that during the period of the survey, where we sort of expected that all the interventions that we would have hoped that government would have introduced, almost 30% of people were still going to bed hungry, or reported going to bed hungry, either themselves or somebody else in their household. So that is actually quite high if you think that this particular group were reporting on experiences that they hadn't experienced before. Okay, 76% had a difficulty in paying for basic living expenses, and they felt that their disability expenditure was increasing during the pandemic. So they were spending more money on aid, spectacles, all sorts of assistive devices, wheelchairs, and so on.
Tim, I'm going to have to hurry you along.
Okay, all right. So very quickly, people.
Can I go on to the next slide?
Yeah, you can go on to the next slide. All right, the conclusion. So the disability disaster framework was far from complete, and we think that was one of the problems as to why people with disabilities were being overlooked in terms of there were many interventions taking place, but it seemed this group was being specifically overlooked. As I said earlier, a lot of the mitigation and control regulations were more about controlling the spread of the virus rather than trying to improve the well-being of people, especially people with disabilities. Their diversity was ignored. So while people might know where to go for vaccines or where to go to get food parcels, they had no way of getting there, and there were no home visits or anything like that. Care services had been interrupted on and off because of people either being fearful of having a carer come in or carers getting ill, lack of transportation, various reasons. So 83% felt that the government should monitor the circumstances of people with disabilities during pandemics to ensure continuity of services and to monitor their rights and to protect their rights. And I think a key thing is that I think globally, the whole response to COVID-19 has been data-driven. But it seems that in South Africa anyway, there's really a lack of disability data before the pandemic started, and disability data was not really a feature of trying to improve the situation or to mitigate COVID-19 within South Africa. Thanks, Mary.
Thanks very much, Tim. So without further ado, we'll go on to our third study, I'm very aware that we're a bit short of time and we want to leave time for questions. So over to Brigitte, who's going to talk about PARDAN.
So PARDAN, or Participatory Action Research with Disabled Adolescents in Nepal, is a collaborative project between UCL Institute of Global Health, Kathmandu University, Diverse Patterns, and IDS, which took place during 2021 and was funded by the UK Arts and Humanities Research Council. Next slide, please. The study began with a scoping review, which looked at the available evidence of the experience of adolescents with disabilities in low and middle income countries of COVID-19 and other humanitarian emergencies. The scoping review found that despite being severely affected by the events, their experiences were rarely documented and they were rarely asked directly about them. So of the 30 studies included, 23 of them combined data from non-disabled children, caregivers, and disabled adults, which made it challenging to understand the adolescents' unique experiences. Next slide, please. Therefore, the objectives of the PARDAN study were to explore how adolescents with disabilities had experienced the COVID-19 pandemic in rural, hilly areas of Nepal, using participatory inclusive research methods, and to develop disability inclusive research methods and tools with the adolescents with disabilities to increase their participation in research about the effect of the pandemic that could be replicated in other emergency settings. Next slide, please. The adolescents with disabilities were identified through local organizations of persons with disabilities, included 12 adolescents with moderate to severe disabilities. 5 of them were girls and 7 were boys, and they were between the ages of 11 and 17 years old. 4 of them had physical impairments, 2 had visual impairments, 1 had a speaking impairment, 2 had hearing impairments, and 3 had multiple impairments. So 2 of those had a physical and intellectual impairment, and 1 had a physical and speaking. And 4 of those adolescents didn't usually go to school. We also interviewed 11 caregivers, 10 grandmothers, 10 mothers and 1 grandmother. Next slide. We used a flexible topic guide to discuss their experiences of the pandemic, covering topics including your story of COVID times, going deeper into the story, family and friends, their recommendations, and anything else. The topic guides were designed to be flexible to different ages and impairment types. The researchers received training about which of the range of interactive tools could be used with each part of the topic guide. The interactive tools were designed to help facilitate the discussion and included pictures, a family of dolls in local dress, illustrated story sequences, an emotions chart where children could put a thumbprint to indicate an emotion, a large soft dice with buttons to indicate numbers to make answering questions into a game, numbered pencils to structure stories, as well as colored pencils and paper. And pictures of these tools in use are shown in the slide and are also in a video which we'll share the link of at the end of the presentation. As mentioned, one of our research objectives was to test out the methods. So researchers were encouraged to try different tools and leave them if they were not appropriate for that impairment type of situation. And after the main interview, the adolescents with disabilities were asked which tools they preferred. And more information on which tools work best for which participants with different impairments can be found in the PARDAN's methods brief, which we'll post a link to later. So our findings related to 4 interlinking themes: economic hardship, fear of death and illness, stigma and isolation, and school and social life. Despite most participants having access to social protection, many families struggled financially. This caused stress and worry in the household. An adolescent with a hearing impairment said, "There's a huge amount of money that needs to be paid to the shop, and I'm fearful about how we will pay it back." Most participants, their families, and their close relatives and neighbors had been ill with COVID-19, and some had experience of death. Lockdown restrictions and fear of discrimination and COVID-19 infection meant that some could not exercise, and they also had limited access to essential support, such as diapers that some needed. Caregivers were particularly stressed about illness and death. If they relied on one earner, they were worried about what would happen if that person became ill. They worried about who would take care of them if they became ill, and who would take care of their child with a disability if they died or were seriously ill. Some adolescents and their families had experienced COVID-19 related stigma and discrimination. For example, a physically impaired adolescent girl said, "I feel very bad. They treated me like I had corona. They didn't let me sit on the bench or in the vehicle." Some caregivers and adolescents felt isolated and unsupported. Another adolescent with physical impairment said, "No one helped. They would run away instead, saying that we were ill." Most of the adolescents with disabilities felt bored and confined during lockdown, and they missed their friends. Those in extended families and with access to internet had a better experience of the pandemic. Adolescents with hearing impairments felt particularly isolated, as family and friends around their homes did not use sign language. Few adolescents accessed online learning, and they missed learning, social contact, and independence. A girl with visual impairment, for example, said, "I cannot play with my friends because school is closed. I cannot read and write. I feel bored staying here. I long for when I can go back to school and feel free." So in conclusion, COVID-19 and related control measures have exacerbated existing inequalities and resulted in increased social and economic deprivation, which has been stressful for adolescents with disabilities and their families. Families who reported being socially isolated felt vulnerable and stressed. Robust social protection and wide community support networks are necessary in this context. Contact with peers is particularly important for adolescent development, and internet access was key to enabling social contact and access to education. Discrimination against adults with disabilities and their families has been exacerbated by COVID-19 and highlights the need to address stigma and harmful underlying social norms. Adolescents with disabilities and their families were fearful of not being able to access care if they became seriously ill, and often relied on help from organizations of people with disabilities. Research with adolescents with disabilities is necessary to plan and implement an inclusive response to the pandemic. Our research tools were effective in facilitating communication about the experiences of adolescents with disabilities and can enable research about intersectional vulnerabilities in low and middle income countries. There's a video demonstrating the process and the methods available on IDS YouTube. It's being shared in the link. And then we worked with a variety of NGOs and so on, as well as other partners who are listed on the current slide. Over to you, Mary.
Fantastic. Thank you, Brigitte, for that whistle-stop tour and beautiful photos. So those are the three studies. So we had the narrative stories one in 5 countries, first of all, and then we had the online survey in South Africa, and then we've had the small study about adolescents in Nepal. So very different kinds of studies, but as you might have noticed, that a lot of the findings had many similarities. So we could see in all 3 studies that there was lots of deep-seated stigma and discrimination that was there already for many people, but quite a lot of people felt that this had become more severe during the pandemic. They felt that their lack of access to services was part of stigma, or lack of awareness of them, or that there were actual personal experiences of being rejected or being regarded as infectious or not being helped. So those kind of things came across in all 3 studies. So there seemed to be a sort of endemic level of negative stereotyping that we know happens for people with disabilities anyway, and we could call this structural violence. The term structural violence isn't used very often within the disability literature, but I feel it's important to use that term because that structural violence is there both in the communities, or sometimes even in families and households. So the person with disabilities may be discriminated against within the family and the household sometimes, or in the community. So maybe those people are not welcomed into community events, or they're not welcomed into community relief processes, and also at the systems level. So we've got that structural violence going through the system, which puts people with disabilities into liminal positions. They always seem to be finding themselves on the edge of what's going on, or being excluded from mainstream activities, or having to make extra effort to be included. And this is despite global treaties like the UNCRPD, which I'm sure a lot of you are familiar with, a groundbreaking treaty from 2007, which was supposed to, and does, emphasize that people with disabilities have the same human rights as everybody else, but that sometimes you have to make an extra effort in order for those rights to be realised. So of course everyone would agree that people with disabilities are equal to everybody else, but when it comes to practicalities, quite often the extra bit of effort that needs to be made to ensure that it doesn't happen. So that extra bit of effort in relation to a crisis like the pandemic was definitely missing. So there are some implications for policymakers and planners, that they really need to think more carefully about writing in a disability inclusive approach. And practitioners, service providers and others on the ground also need to know how to be more disability aware, and to think about how they're providing services and making sure that they're not excluding this group of people. So those kind of findings really came out to a greater or lesser extent in all three studies. So some key messages, which we've mentioned quite a bit already, and I'll just put them up on the screen. So we really feel that disaster and emergency planning needs to be inclusive. And importantly, the second point here is that organisations of people with disabilities need to be included in those planning processes. They need to be represented in those committees and able to say what's needed. And then all the services that we think of as being necessary in a community need to be inclusive and adapted to make sure that everyone really can access them during a pandemic or in normal times. In the South African study, there wasn't much difference between what people said about government and non-government services. So it's quite interesting that although often non-government organisations do step in and fill gaps, they're still not regarded as being able to provide absolutely everything that's needed. Information came up quite a lot, that there needs to be information in multiple formats for people with visual impairment, hearing impairment, people whose understanding is not great and need something more simple. Everybody needs to be able to understand what's going on. The other thing that people with disabilities themselves often say is that they don't all want to be lumped together, that the needs of people within the disability community, if there is such a thing, are very different, that people with different impairments have different needs. So, you know, providing a ramp to a public building is only catering to one set of people's needs. It's not providing for everyone that might need some adaptations. So there needs to be an alertness to the exacerbation of disadvantage that happens when there's an emergency, and there needs to be also, as came out in the study Stephen talked about, an awareness of the emotional and psychological and social impacts, as well as the health needs and impacts. There is still a tendency for disability to be seen as a purely health matter, whereas actually it has a much broader range of impacts, and people with disabilities have a broader range of needs than just those related to their health. Okay, so we're really saying that governments and others need to make sure that their policies and actions are disability inclusive. Okay, so I'll stop there and we'll pass over to anyone from the audience who would like to type a question into the chat box or raise their hand, and we will try to spot those with the hands. I think I'll close the slide so that we can see the hands coming up, I hope. Oh, are you still there?
If you stop sharing, Mary.
Yes, I thought I had. Wait a minute. I thought for a horrible moment I'd close the thing. Wait a minute.
Just in the top right, the little up arrow on Teams.
Yeah, I can't see it now. Wait a minute. Something weird has happened. Okay, should be. Are we back to the main screen?
That's looking good.
Yes.
Fantastic.
Okay, so So I can see somebody called Fazal has his hand up.
Yes.
Over to you, please.
All right, thank you so much. And thank you for this presentation and the research conducted in different countries. It's really amazing working on the disabilities and the impact of COVID on the disabilities. And it was really very interesting. My question primarily goes to Brigitte.
Brigitte?
Pardon.
Yes.
Sorry if forgive me if I'm just misspelling it or mispronouncing it. So my question goes to her primarily, but it could be the question from other researchers as well. As the social media and the digital aspect of current world is really very important in getting connected with different people and being more less isolated in if they have access to mobile phones or internet or other social media. So I just wonder whether the adolescents who were researched, whether they had that access to these resources, and if they didn't have access, whether it was seen in the survey that how it differently affected the people who didn't have access to the resources. And particularly for the deaf and for the deaf people, whether they could have access to mobile phone and how did they enjoyed those things. I don't know whether this was part of the survey or not, but this is what my question was.
So the Pardon study did find that the adolescents who had access to the internet did feel less isolated than those who didn't, which was also, I think, a finding in the Lives Turned Upside Down study as well. An issue is, I guess, that because a lot of families of people with disabilities come from economically disadvantaged backgrounds, they might be less likely to have internet access, and the children within the family might not necessarily have access to the phone if someone in the family does have it. So they did struggle with that social contact, but those who did have it really appreciated being able to contact their friends in that way. So the others, they struggled more. I don't know if anyone else wants to say anything.
Maybe if I could just come in there as well, and Fazal, related to your question, we wanted to make sure that connectivity wasn't a barrier as well. So as Brigitte was saying, many people, if they're from backgrounds where they have less disposable income, they perhaps wouldn't have had the money to pay for connectivity. So we made sure that any data costs were covered as part of the study, but we also work very closely with the organisations of people with disabilities. So where necessary, they brought a laptop or a screen or something like that to the participants to make sure that they could participate, because otherwise you could end up only including people with the resources to connect, and we wanted to make sure that we included everyone.
It was also something which came, some of the people who we interviewed in Kenya were like leaders of small-scale support groups of people with psychosocial disabilities, for example, and they talked a bit about the struggles of having enough money to pay for food, as well as to be able to call each other to provide that mutual support. And then food was more important, so then they were losing those mutual support networks that they had before, and that was a real struggle for them.
Okay, thanks, folks. So there seems to be another question from Karabo Mohale. I don't know if I've pronounced that right, but please go ahead with your question.
Thank you very much, Mary. You said it correctly. My name is Karabo, and I'm from South Africa. I know in South Africa we have been having great concerns that have been raised by persons with disability, because the wearing of masks is compulsory in South Africa, and that has presented a great challenge in terms of communication for people that read lips as a means to communicate. And I'm just wondering, how do we then become sensitive, to some of these challenges and not leave anyone behind, even during a pandemic? Thank you very much.
Okay, over to you, Tim, I think, for that one.
Just because I come from South Africa doesn't mean I have the answer to that question.
No. But we did have a question in the survey about that, didn't we?
It's been a problem for me too, because I'm hearing impaired. So even if you are unable to hear at all, it's a challenge. But even I think people who are able to hear, it's completely without any hindrance. I think a lot of people, just from general surveys, have reported the difficulty of mask wearing. But I agree with you wholeheartedly, and the only way to do this, I think, is to take the evidence, the scientifically based evidence that we've got from this survey and other surveys, and use that to lobby against government to sort out their disaster management and intervention framework. So when you have pandemics, you've got to take into account the needs of persons with disabilities, and you've got to realize these are diverse. So a person who is blind may not have a problem wearing a mask. But I think, as I said earlier, even those who can hear very well have complained over and over that the mask has been quite a challenge. But I think it's a matter of, I see Jill also from South Africa is raising her hand, but I think it's really a matter of taking the evidence and lobbying. And we have to lobby on the grounds of it needs to be universal, but we mustn't ignore diversity. So you've got this universal design, but you've also got to, understand diversity within the context of how you address diverse needs.
But also, Tim, we did ask a question about mask wearing in the survey, didn't we? I can't recall now the results, but it certainly showed that a significant number of the respondents did find communication difficult when using a mask. I don't know if you can recall the results exactly. I can't accurately.
I can't recall the exact percentages, but I mean they were above the 50% level anyway. But it was, I think it was, it wasn't what I was trying to say earlier is that it wasn't only for persons who relied on lip reading. Obviously, for them it was worse. But it was high. I mean, it was over half. But it's again, it's a matter of lobbying. We do have, and all that information, Karabo, will be posted on our various websites, hopefully before the end of March. So we'll have all that information, a summary of the report posted on the IDS website, the Human Sciences Research Council one, and also the National Council for Persons with Disabilities. So that will be there, and it's all open documents. So you're free to read it, free to cite it, free to access it.
Maybe just one thing to say about the masks is that some of you may have experienced these masks with a transparent bit here, which actually a couple of us are just about to go to Bangladesh to do some work, and we've ordered those special transparent masks because we're going to be working with some deaf-blind people and people with learning difficulties. So we're going to see whether those do help, because at least then you can see more of the face and the facial expressions. So people have obviously started to adapt the design of the masks to try and take account of people needing to be able to see more of the face. But we don't know whether those are any better yet. I can see Jill Harness-Hancock there waiting in the wings. Jill, please go ahead.
Thanks. I will just add to the mask discussion. I think this is an excellent example. I mean, we haven't found a solution to it, okay? Because what you're weighing off here is the risk of infection of others in particular, but also of yourself, against the right to participate on an equal basis in society. And yes, the masks that you just suggested is an attempt of universal design. For us, it didn't work. The mask is actually like it's fogging up, so you don't actually see anything. So it's not the solution yet. But it's an attempt. That's how we have to see it. And I think this is where particular deaf people have to come in the design. And that's, nothing about us without us. That's where it is, to design that. I mean, we in South Africa, we also have tried the shields. Some people try to wear shields instead of masks, and actually doesn't have the same effect in terms of protection. But masks also don't, shields also don't work for deaf people, because some of the signs that you are doing are actually on your head. So you're using signs that are sometimes have. I think our maybe sign language interpreter can even show. Yes, she's showing it, right? When she's talking about the head, if you all see, she's using the head. Yes, there she goes. She couldn't wear actually a mask, a shield, right? It would be a problem. So there are some attempts, and universal design, that's what it is. We all have to figure it out, and for that we need people with disabilities to help to figure it out. So I think that's what I can say, Karabo. Like, that's maybe the next exercise to drive, or research to drive. How could a mask look like that is universally useful in the universal design? And maybe while doing that, have in mind that there are people that are autistic and that have particular problems in wearing masks for other reasons.
Yeah.
And what is that universal design that a mask would wear? Because that wasn't the last epidemic that we had, that's for sure.
No. Great, thank you, Jill. I don't see any more hands, and I'm very aware of time, particularly that Sandra, our sign language interpreter, has to go in a minute. So can we just have one more question, and then we will need to close? Any further questions? Let me just check in the chat. I don't think there's no more hands up.
I have just sent one question in the chat. If you could have.
Oh, please speak it out loud. That would be great.
So I have sent a question in the chat box, but I can just read it out if that's okay.
Please do.
So my question was, because of my background from Pakistan and my work in Nepal, I have noticed that people with disability who have a decent job or business, they are look less different, and respect starts and the stigma fades away slowly. But if those who don't have that income are relying on other people, they are in worse situations. So whether this research did notice this difference in their research.
Okay, shall I start off and then somebody else can continue? I think this research that we're talking about today didn't particularly focus on the benefits of work, although some people definitely said that they were suffering because they'd lost a job. But at IDS, we're doing other work about inclusive employment and about getting people with disability into work more. And it's a very important part of increasing their self-esteem and increasing their opportunities to contribute to communities. We all know that having a job is generally good for your well-being and gives you a status in the community, mostly, depending on the work. So we're doing a project with other partners called Inclusion Works, which is in 4 of the countries that we've already mentioned today. So very much that area, it's an area of disability research and disability intervention that is very live at the moment. We're in this project, which is trying to look at what the factors are around getting people with disabilities into inclusive employment more. And we know that the rates of employment for people with disabilities are lower than for everybody else in every country in the world, I think. It's a consistent finding, whether you're talking about the UK or Nepal or Uganda or wherever. It's hard for people with disabilities to get into the kinds of work that they may want to do. They're either given a job that's of a lower qualification than they have, or they're rejected for some reason, or the accessibility isn't good enough. So yes, it's a good point. I don't know if Stephen or Brigitte want to add to that, because they're also involved in Inclusion Works.
I'll just share in the chat box there a working paper focusing on disability inclusive formal employment, and just as Mary says, it's kind of a work in progress, and we've got various research outputs in the pipeline which are at various stages, but please do keep an eye out for those, because they'll be coming out in the next few months.
Okay, so on that note, I think we need to stop, because we know that Sandra, the sign language interpreter, needs to go, and we can't really continue without her support. So it just leaves me to thank all the speakers, and particularly to Tim for coming all the way from South Africa to see us here. Those of us who are physically anywhere near IDS are going to meet for an in-person cup of tea and a piece of cake. So if you're in the building, then you're very welcome to come along. Thank you to Sandra and Louise for interpreting. That was great. And thank you to James and Ben for their support, logistical support, in putting this seminar together. So if any of you have a need to get in touch with us, please email us. And if you'd like the slides, we can also distribute those, which do have some reading material in the final slide. So many thanks, everybody. Bye-bye.
Bye-bye. Thank you.
Thank you.